Hello, hello, hello. Welcome to SamiraSultana.com. Hope everybody is keeping well today in this very beautiful Friday morning. Good morning, good evening, good afternoon to all the people watching us today and to all the people who will be watching us later on. Do leave a comment below. Those of you don't know me, I'm Samira, a teacherpreneur, mompreneur, and a digital business owner. And this is my page. I'm the CEO and boss of this page. And today I'm very, very, very excited. Why is that? Because today we are in episode one of For Your Wellbeing, our special episode for this month. And we have a very, very special guest who is joining us today. And she is a periodontist, a specialist doctor over here in United Arab Emirates. And she's here to deal with us with all health related, teeth related, and kids care oral hygiene. And I'll be just welcoming her. So, Dr. Priya, the stage is yours. Welcome.
Hi Samira, thank you so much for having me here. Hello everyone, good morning. As per UAE, good morning. I
Yeah.
am Dr. Priya. I am a pediatric dentist, that is specialist in kids dentistry. And currently I'm practicing with Tajmeel, which is in Abu Dhabi. Also recently opened in Dubai and Alain. And I'm very
Wow.
excited to answer to all your questions. So yeah,
Okay.
let's start.
Yeah, so we are having Asma who is welcoming us. Assalamu alaikum, wa alaikum assalam. And we have Fatima also who is welcoming us. Thank you for joining. Wa alaikum assalam. Thank you so much. So, Dr. Priya, tell us a little about your background, about where you are from and what you have been doing, how many years you are there in UAE. Let the viewers know about you a little more.
Sure. So I am basically from Mumbai, India, and it is my marriage that has got me to UAE. So
Amazing.
since then, I am in UAE, like you can say, since 2017. But I could start practicing in the UAE since 2019 because of the rules and documentation work and everything. Until then, I was practicing in Mumbai, and I'm very much keen in, along with treating kids' teeth, I'm very much keen in even entering into their psychological level, treating in a way that they are not afraid of dental visits, dental treatment. So yeah, I have skilled myself in clinical hypnotherapy also, which helps me take my treatment level to a different level, as in it makes it easier for them to accept dental treatment, to be friendly, to be fearless in the dental clinic, and I love my job absolutely.
Amazing, Dr. Braid. It is so nice that even when I visited you earlier, my son had a wonderful time. I really loved it. My
I'm
son
glad.
still remembers you. Here there is Lubna Muhammad also. Thank you for joining. Assalamu alaikum. Walaikum assalam. Thank you so much. So, viewers, those who are watching us, you can leave a comment below. You can ask a question related to dentistry. Here, Dr. Priya is with us. So, I have a few questions to ask you, which was sent to me earlier by the viewers. Here, let's start with tell us a bit about why do you think taking care of the teeth at an early age is so important? Like from the beginning itself, from when they start growing the teeth, why do you think we have to be very conscious about taking care of the teeth?
That's a very good question. See, everything in our body has a role. So why we have been gifted with two sets of teeth is because one set, the fine permanent dentition, is too big to accommodate in the smaller jaws. So we
Okay.
have this primary dentition, which is also called milk teeth, which is also called deciduous teeth.
Okay.
So these teeth, they are helping the kid in chewing, in they also in indirect way they regulate the bone growth, the jaw growth. So it is very important for us to keep them healthy and to make sure that they remain till their job is done in the job. Obviously, without teeth, the diet and the nutrition of the kid will be hampered. The confidence level of the kid will be hampered, like you've seen in many cases, kids with the upper anterior, upper front teeth, they become black, they become yellow, brown. eventually they break, and that really affects the confidence of the kid in the school, amongst their friends. Also the parents are concerned later that, how can we fix it. But if they are very much destroyed, the only way is removing them. We cannot, after a certain level we cannot fix it, we have to remove. But to help with their confidence level amongst their peers, we have appliances, prosthesis appliances. But again, with those appliances, challenges come to maintain oral hygiene that the parents have to take care about.
Yeah. So you're saying that,
And the new teeth will come
yeah.
only at the particular age. We cannot take it out before that age, so we have to wait till that age. It's called, the natural teeth is the best to have in the mouth rather than having any processes or any other appliances. So better take care.
Okay, amazing, amazing. Thank you for that great information. We have our viewers asking a few questions. Here there is Fatima who is asking. It's regarding her son who is at a tender age, 7 to 8 years. How do I stop grinding his teeth at night? He's 5 years old. Okay. So he bites a lot during night. So she wants to have a solution for grinding. Like, do you have any suggestion for that? He bites
Yes.
often.
Thank you for reaching me, Fatima. For this, I would like to first tell you that you need to know the reason why he is grinding his teeth. There can be various reasons why a kid grinds his teeth during sleeping. It could be the infection in the gastric system, for which you have to visit a pediatrician. So there is a treatment for worms in the intestine. So you need to treat that if that's the source. Another thing, if the kid is going through something which is making him nervous, anxious, maybe in his school or in his house or wherever it could be possible,
Okay.
you need to try to know the source of the reason. After that, we can take care of this grinding of teeth thing. Well, coming to the dental part, there are night guards which are available, which a pediatric dentist or any dentist can make for your kid. If you make your kid wear the night guard, the at least the grinding of the teeth will not damage the teeth. Otherwise, it will make, if the teeth keeps on rubbing on each other, it will make it worn off. So you don't want that to happen. So at least meanwhile, you can start making your kid wear night guard. It's just a plastic thing which will fit onto your kid's upper and lower teeth completely. So they will not get worn off when he's grinding and
So,
when he's sleeping. But certainly you need to know the reason why
so
this is
is
happening.
it available? Okay. So will it be available easily?
Yeah, if you go
This
to any dentist or a
attachment.
pediatric, yes, if you go to any dentist or a pediatric dentist, the doctor will be taking the impression, the size of the teeth, upper and lower jaw, all the teeth, and after like few days, they will provide you the plastic thing, night
Okay.
guard.
Okay. Wow. Amazing. That's a new information. I never knew about this. Actually, my son himself earlier, he used to grind a lot, but I just ignored it. That's what I did. Okay. Fine.
Usually,
Thank you
you
so
have to do
much.
anti-worm treatment. Usually, that's the cause, because kids are not very
Yeah.
careful in what they are eating and drinking. They keep
Yeah.
on putting foreign objects in their mouth.
Absolutely, absolutely. So here we have Asma Chishti. She would like to ask a question to you. Doctor, I would like to ask my son who is 9 years old. His premolar tooth just fell off recently. So is it natural? What do you think? Is it natural?
It must not be premolar, because premolar is only present in the permanent dentition, the second set of teeth. So in the first set of teeth, like I cannot be very sure about what you're saying, but yes, as per my knowledge and experience, it must be the milk teeth that fell off. Those are called molars, but deciduous molars or primary molars, they cannot be premolars. So don't worry. I guess if he's 9 years and it's falling off, it's absolutely natural. But again, I need to see.
Okay, amazing. So we will have to go back to the names of the teeth, which are in order, and then we'll figure out which teeth actually fell out, Asma. Okay. Okay, so there is a question which was sent to me earlier that is regarding fluoride. Do you think fluoride is recommended for small children, or is
That's
it
my
when they
favorite
grow up?
topic. That's my
Okay,
favorite
would you like
topic.
to give some insights on
Absolutely
that?
recommended.
Okay,
Absolutely recommended for kids. In fact, since the first teeth is emerging into the mouth, it is recommended for the kids because see how fluoride works is tooth is made up of a structure, hydroxyapatite. So when we give fluoride topically to the tooth, what it does is eventually it is very a gradual process. It cannot happen immediately. Hydroxyapatite is a strong structure, but it's not very strong to oppose the acid attacks. So when we apply fluoride, fluoride replaces the hydroxy part and it makes fluorapatite, which is
fine.
even stronger. So we want to do that with the teeth so that it
Okay.
even prevents that it even fights back the acid attacks and we don't get cavities to see that often that fast. I will not say that fluoride can 100% prevent cavities. Obviously there has to be other things like brushing, flossing, regular dental visits, topical fluoride therapy in the dental clinic. Not just any one of the preventive procedure can prevent cavities 100%, but it has to be a combination of everything, which would give you a 100% result. Taking
Okay.
care of your diet, and
Hmm.
lesser frequency of having sweets, because if you keep having sweets again and again, like you give your kid a sweet can be anything, milk, anything that contains natural glucose, fructose, milk or chocolates or any other juice. If you keep on feeding your kid with all these things every 1 hour, half an hour, again and again, so the acid level in the mouth keeps on increasing. You are not giving the acid level to go down. This ultimately and eventually gets into cavities in your kid's mouth. So this is why we say that give only once in a day anything sweet or acidic to your kid. I know it's practically not possible, but then again, you can take care by asking your kid to brush, rinse immediately so that it doesn't remain in the mouth, or give something which is um, neutralizing the acid level, like cheese. Cheese can
Okay.
neutralize the
Mhm.
acid level. So if you ask your kid, if you're going out somewhere in the mall or somewhere, carry something, a cheese cube in your purse, and you can ask your kid. It will not clean the teeth, but it will at least neutralize the acid level. That would be helpful. Hello.
So you're asking us to carry cheese while we are traveling? Is that how it
It's
is?
it's better, or sugar-free chewing gums.
If it's possible,
If your
right?
kids are fond of sugar-free
Okay.
chewing
So
gums,
in short, I want to say that fluoride is good for the teeth. Oh yeah, that we can do that. Okay, thank you for that. Great information. Fluoride toothpaste are recommended for kids at a very early age itself. That's what is the insight of this topic. So here there is Liz Florence. She's giving her regards also here. One minute. Yeah, here. Can you see that? Yeah, she is asking a question to us. Is there an age limit to when you get braces? Can we have braces at a very young age? What do you think? Braces.
okay. See, now it depends. What does your child need the braces for? Hello, can you hear me? Okay, it depends. What does your
We
child need the
have a bit of a
braces for?
connection here, connection issue. Yeah. Yes, yes. Okay.
Now you can hear me.
Yes, yes, yes. Yeah, you can just talk about the braces you were talking about. Why
Yes, yes,
do you
yes.
think and when do you think the child can start using braces? Yeah, age
So
limit.
if the orthodontic treatment or the braces treatment need to use the growing age of the kid, the ideal age to start the treatment is between 8 to 9 years. that the orthodontist is the best person to assess if the lower jaw is in front of the upper jaw, then you have to start early. Then otherwise you have to start after the permanent
Okay, fine.
dentition is majority in the mouth, that is 12 years. So it completely depends what is the treatment that your child needs in case of braces. If it needs the enlargement of the jaw, then you have to start earlier, otherwise late. So that is to be assessed in the clinic. I think there is a connection problem.
Yes, yes. So braces can be used at an early age, but it depends on for what is the need, right? That's what you're saying. Thank you, Liz, for your amazing question here. And then again, we have Jackie. Jackie, she's also she's giving her regards. Hi, thank you so much, Jackie, for joining
Hi.
us. And Asma, she is very thankful for you to answer her question. Uh, and also, Fatima says that she is going to follow up. She will follow up soon about the grinding. She has sent you the question regarding grinding.
Most welcome.
Now, there is a question from Lubna Muhammad. She talks about, can you give advice on how to deal with special children with dental issues? If a child has cavities at a young age and she's a special child, do you have any tips and tricks for her regarding that or him regarding that? A small tip to help the parent out, if you could advise.
Hi, Lubna. Thank you for your question. Well, for special children, I would like to say that it's better, like prevention is better than cure always. So you have to make sure that you give your kid a lot of fibrous food. Just cut down the sugar intake of the kid. I mean, most of them they like to have sweets. If you want to give them chocolate, prefer giving them dark chocolate rather than milk chocolates, as milk chocolates lead to more cavities compared to dark chocolates. So, regular brushing, flossing, sometimes it's difficult to even practice that in the daily routine, but you have to. You can use finger brushes that are available in the pharmacies and help your kid clean his or her teeth every day, regularly after every meal. Go for topical fluoride treatment to the pediatric dentist. This will make your kids' teeth stronger from outside, as I mentioned before, how fluoride works on the teeth. So this will obviously help your kids' teeth fight the acid attacks. And regular dental checkups would be very helpful. Regular cleaning, good food, and flossing also. Many parents, they are not aware that along with brushing, flossing is very important, because brushing only cleans the top surface of the teeth, the sides of the teeth, but in between the teeth is not clean until and unless it is flossed, because all the teeth are hugging and touching each other. The bristles cannot really enter in between the teeth. You need to also start flossing. Am I audible? There is an
Okay, fine. Fine. Thank you so much for your question. Yes, yes. Today, actually, the weather outside is very, very windy in United Arab Emirates. So there are a few glitches now and then, but we are audible. Yes, it's fine now. So again, here there is Jackie, who is continuing with the braces question here. She is wanting to know whether the braces must be adjusted monthly. If in case we start with braces, is there anything of adjusting it, or what is the time limit that we have to make changes? Is there something related to that?
Hi, Jackie. Yes, absolutely. The braces needs to be adjusted because
Yeah, the question was
braces
relating
are.
to braces. I don't think it's audible.
Hello. Am I audible? Okay. Hi, Jackie. Yes, the braces, they need to be adjusted
Yes, yes,
timely.
yes, we are hearing you. Yes, yes.
Time
Continue, dear. Continue.
timely because braces are put for a reason that we need to have some teeth movements in the jaw. So certain amount of forces are generated in the wire when we put braces. Once the teeth is in the position, the forces become less, and now we need to change the direction of the forces. So you have to visit the orthodontist regularly and timely as per advised. Otherwise there is no use. The after a certain time they become passive and there is no improvement happening in the alignment of the teeth. So absolutely they need to be adjusted monthly. I hope that answers your question.
Okay, okay. Okay. Thank you, Jackie, again for your amazing question. Yeah. Yes. Thank you again. So here there is Lubna Muhammad. She also thanked you for answering our
Welcome, Lubna.
question. Thank you so much, Lubna, for that amazing question. And we have one more question here. It's about what kind of lifestyle will help your teeth. That's a question from Fatima.
Will help my teeth.
What kind of lifestyle will help you have better teeth? Like, what are the
Okay.
things or the foods you recommend for healthy teeth, or what are the nutrients or minerals which you will use for having a proper teeth balance? Some advice.
Okay. So that's very useful questions for everyone. Well, you have to be careful that you don't have a lot of
Yes, doctor.
staining food. We as Asians, we have a lot of turmeric in our food, which obviously tends to stain. Then some habits
Yeah.
like I'm sure not many have it, but if someone has it, like smoking and tobacco and all, also they change the color of the teeth. So all these need to be avoided, and even if you're having it, make sure you rinse your mouth after that, or you have something fibrous after that so that it washes off your teeth. You don't need to always look for a brush after having something. You can have something like apple or celery or any vegetable which is very fiber. Green leafy vegetables can also wash off and
Okay.
clean your teeth. um, Again, following the routine dental hygiene protocol, brushing twice, flossing, cleaning your tongue. Cleaning your tongue is also very important because it harbors a lot of bacteria, microorganisms. So you need to even every day clean your tongue whenever you're brushing. Flossing can be done once in a day, but yes, all these things will help you to maintain your teeth.
Amazing. Amazing. Thank you so much for that information. So then again, we want to talk about the beginning of a cavity. How do you realize that we are starting to begin a cavity? Like, do we see the marks or do we understand the pain? What do you suggest? Like, what are we looking for?
Okay. That every parents need to know this, really. I mean, because
Yes,
I
yes.
usually get so many parents who are so late and then they feel bad and guilty about why not paying attention to it earlier. So there is something called lift the lip technique. Every month, like, or anytime you remember, minimum once in every month, you need to lift your kids teeth, the lips, and just check the front teeth.
Okay.
They are the first ones to come out in the primary dentition.
Okay.
Just check the
I didn't
front
know
teeth.
that.
Check for any
Fine.
white spot happening in the teeth. Any white spot. That white spot is the beginning of the cavity. If you see that, you have to come to the dentist without any delay. Well, by the way, the ideal age to come to the dentist is when you see the first tooth emerging into your
Okay.
kid's mouth, or before your kid's first birthday. This is when you should visit your pediatric dentist for the first time, and anything later than that would be fine, but recommended thing is when you see your kids first teeth coming out or before your kids first birthday. And yes, do practice lift the lip technique regularly with your kid so that you are not too late in fixing them.
Okay, fine. So you are asking us to look at the white portion or the black portion? White dot or black dot?
No, no.
exactly?
It starts with
When we
a
lift the
white
teeth,
lesion.
it's a
Yeah, it
white.
starts with a white lesion. The cavity does not start directly as a black lesion. It first appears as a
Okay,
white spot
fine.
on the teeth. Like the teeth is obviously white, but it will be even whiter than that thing. You can differentiate
Fine.
it. That means it's getting decayed
Ah,
from
okay. It's
inside.
like
It's
that.
yet, yeah, it's not yet cavitated, but it's hollow. It's getting hollow from inside. After some time, if you don't take care of that white lesion, see, that white lesion can be taken care of by applying regular fluoride, using a good like regular fluoridated toothpaste, and there are other several home cares that can be done to control it, along with visiting the pediatric dentist for the topical fluoride varnish treatment. But if we don't take care of that white lesion, very
Okay.
soon that will become a cavity. It will start attracting stains and become yellow, and then it will get advanced to becoming black. After which it gets so fragile that it starts breaking off, chipping off completely.
Okay.
So yes, if it's white lesion, it's still not too late. You are well in time. You can save your kid's teeth.
Okay, excellent. So there is Asma Chishti. She would want to know: is the herbal toothpaste better for kids, or the fluoride toothpaste is better for the kids? Sometimes it is recommended that use herbal toothpaste when they are young. What do you suggest, doctor? Which one do you think is better from both of them?
See, I recommend fluoride toothpaste. Also, other
Yeah.
guidelines, they say pediatric related guidelines, they recommend fluoride toothpaste since the age of 6 months itself. Also, it depends on where you are, which city you are living in. If the drinking water contains a lot of fluoride, which you can find out from your community water provider, that what is the level of fluoride present in the drinking water, you can inform this to your dentist or your pediatric dentist, and then your pediatric dentist will let you know whether your kid needs a fluoridated toothpaste or not. In toothpaste, the fluoride level is very safe. You can see it written in the ingredient on the side of the tube how much ppm fluoride is present in the toothpaste. So for kids, it's recommended that 1000 ppm fluoride fluoridated toothpaste to be used. Hello. 1000 ppm fluoridated toothpaste to be used, but if the kid is below 3 years, use only a rice size of toothpaste. If the kid is 3 to 6 years, use a pea amount of the size of the pea amount of toothpaste, and 6 years above, you can use a ribbon of toothpaste on the bristle of the toothbrush. But minimum recommended
Okay.
is
Okay.
1000
Fine.
ppm.
Fine. Fine.
There are many
Thank you. Thank
brands
you
with
again.
even lesser than that. So you can start the toothbrushing toothpaste training for your kid with a lesser amount of toothpaste. And after brushing, try not to make your kid, if he's very small, he or she below like 4 years or something, to rinse the mouth, because they are not sure whether they will drink it, swallow it, or they'll spit it out. It's okay to leave it like that, leave the toothpaste in the mouth without being rinsed, because that will only give it more time to act on the teeth topically. So you don't need to force your kid to rinse the mouth after using toothpaste.
Okay, amazing. Thank you again so much for that insight. And would you like to say something about dental implants? Like for small kids, at what age they can do dental implants, or is there any side effect or pain for small kids if they do such kind of root canal treatment? Is it possible to do at an early age?
No, dental implants are not for kids. They can be done
Okay.
only after the growth stops. So they are
Okay.
certainly not for the kids.
Okay.
They can be
So,
done only in
and about
adults.
the side effects also later on we will see that, because it's not for the kids, right? Yes, as
Yeah,
you,
no
yeah.
problem. Dental implants.
Oh, okay,
See, it's
fine,
for the
fine,
adults,
fine. So
but
here
along
we
with
have a
that, you need to
question
maintain.
regarding X-rays.
I think it's overlapping.
A question
There's a lag.
regarding X-rays.
Okay.
Yeah, is it clear now? I don't know exactly. There's a
I think
lot of wind
there
today
is a lag
outside. I
because
don't know about your area, but in my place there is a lot of wind. So sometimes connection is not stable. is it, is it clear now?
okay,
Yeah,
okay, okay.
yeah, it's fine. So one more question I would like to ask is about the X-ray. We take
Hmm.
X-rays during our dental checkup. Doctors usually take. So does that X-ray have any side effect in the mouth or in the head or eyes? There are some parents want to know that. Is it actually necessary to take it?
Okay, yes. To for your relief, I would say that X-ray, the radiation during taking dental X-rays are very less, and it's not that very frequently your kid has to take it. So it's more than that, you are exposed to radiation and other situation in our day-to-day life, like sitting in a flight or something like that. So you don't need to really worry about that. And obviously, while taking
Wow. Yes.
dental X-rays, a full mouth X-ray, your kid is made to wear the lead apron, so you don't have to worry about
Yeah,
that.
fine.
And
Yes,
the
that's
small
true.
IOPAs, what we call as IOPAs, they have very minimal exposure, so do not worry about that. In fact, we dentists are the ones who are exposed more.
Okay.
And yes, they are important to take dental X-rays because we have to see what's going on inside the bone. If we don't come to know about that, we cannot proceed with the treatment plan. So
Fine,
there is
fine,
no
fine.
no harm doing
So
X-rays,
that's an
small X-rays once in 6 months, or the
information.
big, yeah.
Okay. So, well, we are over half an hour. I really don't know how much of your time I can take, but I do have a few more questions. I limit it as much as possible.
No problem, no
So,
problem.
yeah. There's a question about morning breath. Sometimes the children, when they get up, they have a kind of pungent smell. So, is there any way to avoid it, and what causes it so much? Like the bad breath, no one likes the bad breath. So, what can be the possible reason?
Okay, so there can be several reasons for that. To start with, first is the gastric
Yeah,
system again. See, because mouth is the external window for the gastric system. So if the kid is not having enough water, or there is some infection in the gastric system, that can give out this bad odor, bad smell. Another reason could be not brushing before sleeping. So if the kid is not, or if anyone is not brushing before sleeping, there is already some amount of food stuck on your teeth, between your teeth and your gums, which are not washed off while you're sleeping because you're not having water, you're not eating anything, there is no activation of saliva in the mouth, so nothing is getting washed off. It is there at that place. Also, along with those food, there is bacteria in the mouth, on the tongue, which keeps on doing their work when you're sleeping. So yes, even if you don't clean your mouth or your tongue before your kid sleeps or you sleep, this can lead to bad odor the next morning. And
fine.
depends on what you eat also. A lot of garlic or onions can give a lot of pungent bad odor when you wake up the next morning. So it's very important to
Okay.
brush before
So,
sleeping, because if you're not doing that, you're leaving the bacteria with their food while you're sleeping. They are working on their activity of damaging the teeth.
okay, so we have very nice information. And also, are you recommending that we should drink water and sleep? Is that good?
You should clean your teeth. Drinking water is a full day activity. Like lesser intake of water can lead to ulcers, can lead to bad breath, and many other systemic problems also. Dehydration for kids, especially.
Okay.
So water is a generalized thing that you should, because kids, they fail to remember to drink water. But certainly flossing, brushing, tongue cleaning is very much recommended before
Okay.
sleeping.
Fine, fine. Yeah. Okay. So thank you again for that. Now we have Yash Bohra. Thank you for joining. What are the 5 important things every parent should do to every day to maintain dental care for their children? If you could advise a few tips to avoid cavities and dental hygiene, some important things what a person can do. Could you please give some suggestions
My
and
pleasure.
solutions?
Okay, so first and foremost, I have been repeatedly saying this, that brushing twice, don't forget to floss at least once a day, because I mentioned that before, that brushing would take care of the other surfaces which are visible in the mouth. But flossing will take care of the surface which is not visible, which is in between the teeth. So certainly flossing needs to be done. Now I'll just I would just like to show that flosses available in the market,
Fine.
they're very easy to use, like this. If you all can see, this is very easy to use. So you can get this for your kid and you can make it a daily practice for them. Maybe you can start using it. They will enjoy doing it if they look at you using them, and it will become their
Yeah,
habit. And
absolutely.
with kids, it so happens that once they are used to something, if they don't do that, they will not want to sleep. So that's a very good thing. Many kids I have seen that they're used to brushing. So until and unless they don't they brush their teeth, they will not sleep, which is a very good habit. So yes, brushing,
Amazing.
flossing.
Yeah.
Also, if your kids is more prone to cavities, there is a paste called tooth mousse, which is available in pharmacy, online. You can apply that. That's recommended as per directed by your pediatric dentist. You can use that in the night. Tongue cleaning,
Okay. Yeah.
also tongue
Uh,
cleaning, and good dietary habits, like not giving them very frequently chocolates and sweets and juices,
yeah.
sodas.
Yeah. Nowadays it's summer vacation, and I'm sure children are prone to have so many of chocolates, juices, etc.
Also
So,
chips.
yeah,
Parents
thank you
think
so
that
much
chips cannot.
again, Yash Bohra. And now we have another guest here who is Mohit. He also has a question for you, Dr. Priya.
Yeah.
Yeah.
So dietary.
Can you please tell us about specific dental care and dietary habits for kids with caries prone teeth?
Yeah, sure. Specific dental care again would cover what I just mentioned. And in case of dietary habits, I would say
Yeah.
that fibrous diet would be taking care of the food that must be stuck on the teeth. Avoid giving them chocolates like lollipops or some sticky chocolates, marshmallows, which can stick to the teeth. Prefer giving them dark chocolates rather than milk chocolates. That would be less harmful for the kids. You can obviously not devoid kids from having chocolates, but you can take care what kind of sweets you're giving them. If
Let's.
any sugar-free options are available, prefer that alternative. Give If they like chewing gums, you can give them xylitol chewing gums or sugar-free chewing gums, which are very good for teeth. In fact, giving them chewing gums, obviously, if they like it, and after they are old enough to manage eating chewing gums, you can also keep sugar-free chewing gums with you all, that after having or eating anything sweet or teeth-damaging food product, if they chew on these chewing gums, it will clean the teeth and it will neutralize the acid level in the mouth, which will be ultimately helpful for the teeth. I hope that answers the question.
Yes, yes. Thank you again for so much valuable information. Here there is Asma. She is also very thankful. Thank you so much, Samira and Dr. Priya. Your session was
Thank you
excellent
so
and
much.
informative. Thank you, Asma, for your sweet comments. And then again, let's see, we just have one more question, and I wouldn't want to take so much of your time again. What do you see about sensitive teeth? Like sensitive teeth, children sometimes they have a little pain while drinking very cold water or very hot. Sensitive teeth is a common thing nowadays. So, how do we avoid it, and why do we have it? First of all, why do we have sensitive teeth?
Yeah, very common. It's a very common scenario these days. In fact, even earlier, but maybe earlier nobody
Yeah.
really cared about it. Well, sensitive teeth do happen due to various reasons, like cavities also can make your teeth sensitive. Then gums going down can make your teeth go sensitive, become sensitive. As in with kids also that can happen because
Yeah.
of some habits. You like playing with the pencil on the gums, any on 1 2 teeth while studying, they don't realize and they're pushing the gum down, so that can make it sensitive. Then in generalized way the teeth are sensitive because there are layers of enamel and dentine on the pulp. Pulp is the place where in the teeth there are nerves present, nerves and blood vessels. So if the dentine, I'm going really technical, I don't know how much am I able to explain. But dentine are the place of the teeth which are very sensitive, and on that is the covering layer of enamel. If enamel is thin, the teeth can appear yellow or the teeth can be very sensitive. So these days there are mainly toothpaste available for desensitizing. What they do is they are blocking the canals, the pathway into the dentine, by releasing few minerals, few elements into it. So somehow it is very helpful, but that obviously doesn't happen very quickly. It takes time. Also, topical fluoride varnish treatment, again I would mention, would help your kids in dental hypersensitivity. If you get that done regularly, fluoride topical fluoride varnish treatment will be very helpful for the sensitive teeth for your kids.
Yeah. Okay, fine, fine. Thank you. Thank you so much again. Yeah, there is Mohit also. Thank you, Dr. Priya, for the information. Thank you, Mohit, for joining us. So, did we cover up all the points? Dr. Priya, is there any advice which you will want to give to the parents, which we have missed maybe in all this conversation? A few tips and tricks and final advice to the parents watching us, to the followers and viewers. What you would like to tell them as a small advice to them?
As a pediatric dentist, I would just say that teeth is very important because it will decide the nutrition level of your kid. So it's not just the teeth, they are the first thing that will make your kid eat or drink what you want the kid to have. If their teeth is not good, they are not going to eat anything healthy. Ultimately, it's going to affect their health. So do not ignore it. Take your kid to the dental visit
Yeah, of course.
as frequently as possible, every 3 months, at least every 3 months, not less than that. And regular dental checkup, I have seen personally, has led to a lot of good oral hygiene scenarios. Many patients parents are so careful that they keep getting their kids even if they don't have cavities. And if I find any white lesion, I take care of it then and there, and I inform the parents about it. So yes,
Okay.
dental hygiene, oral care is very important as much as it is important to take care of any other part of the body. Also, I would like to add on to that
Okay.
even if your kid, a newborn, is not having teeth, it is important to wipe the
Huh?
gums. In fact, I have
Okay.
put a video on that on my Instagram and Facebook, how to do that. Even if your kid is not having any teeth yet,
Yeah, I'm
you
there.
are breastfeeding or you are giving a bottle milk to the kid. It's very important to clean the gums, wipe the gums after you feed the kid. Every time after you feed the kid, it's very simple. You just have to take some soft cloth in your hand, wrap it around your index finger, keep a clean water, drinking water beside you. Just dip your hand in the drinking water and wipe the gums, the gum pads of your kid, of your child. That's it, and it's clean. You don't have to do anything more. But yes, that's important to do, because otherwise you are letting the bacteria harbor even before the teeth are coming into the mouth.
Amazing, amazing. Good information for all the babies and all the moms who are watching us. And of course, Gina, again, thanks again for joining us. Thank you so much. So, Dr. Priya, how could people contact you? There are parents who are willing to contact you. And how can they keep in touch with you? Could you please share your ID so that they can also follow you or ask you any tips later on? Those who will watch replay especially.
Oh, I would love to hear from the parents who need to ask anything and reach out to me. Well, I'm available on Facebook also and Instagram also. For both, my ID is Dr. Priya Purwal. You can just message me on any of these platforms and I'll be there. And if you want to meet me in person, I am practicing in Tajmeel, Shahama, Abu Dhabi.
Okay. Amazing, amazing. Thank you, Dr. Priya. Yeah, Lubna Muhammad, she is also just thanking you. Thank you for the informative session. Thank you for joining Lubna Muhammad with us. So here was Dr. Priya. I know there are many other questions. We have covered 46 minutes. Never I have done a session so long. It's 46 minutes and it's a Friday weekend. I know it's a time to enjoy with parents. Yeah, there is Fatima also and Mohit also. Very informative session. Thank you so much. Yeah, thank you all for joining us. And those of who will be watching later on, you can do leave a comment. And you can see in the banner, there is the contact details of Dr. Priya. Her Instagram page link is already in the banner below. And my contact details is also in the banner below. Of course, I will write it again in the post later on the Facebook page and the Instagram page. So, to end with the session, first of all, I would like to end with a quote: let your smile change the world. I hope it makes sense in this
A lot of
venture.
sense. Yes, that's a very good quote.
Thank you so much. Yeah, thank you so much. Kalpana Jain is also here. She is also very thankful. Very nice information, Dr. Priya from Jiansh. Okay, thank you, Kalpana, joining us today. So again, thank you. Thank you, Dr. Priya. Preeti Jain is also here. Wait, let me just thank you all for the information, Dr. Priya. And again,
Most
from
welcome.
from the bottom of my heart, thank you so much for joining us today. It
It was
was
my
very
pleasure to be
amazing.
here. Thank you so much for having me here.
Yeah, it's a pleasure, and we'll keep in touch. And all the viewers and followers, those who will be watching the replay, do leave a comment below and stay safe and blessed and have a great day ahead. Okay, thank you. Bye
Thank
bye.
you. Thank you. Bye.